Welcome, everyone, to this episode of Office Hours. I'm your host, Stuart Newsom, and today's session is titled Reducing Cost to Collect, the AI Wave, and How to Multiply Its Impact. Now, joining me today is Anthony Amaya. He's our VP here at Infinix. Anthony, it's great to have you here. But before we jump in, I just want to give you a quick, opportunity to say hello and tell us a little bit more about yourself.
Yeah, thanks, Stuart. As Stuart said, I'm Vice President at Infinix. I'm Vice President over acute care operations. So my focus is mainly working with hospitals, but of course, that includes hospitals and IDNs include everything kind of under the sun. My background with Infinix, though, I came from the management consulting division at Infinix as well. So a lot of background doing various things under the management consulting umbrella as well.
Awesome, awesome. Thanks so much. And I'm really excited about this conversation because cost to collect is really a vital leakage, if you will, or concern amongst not just hospital systems, but also those in the ambulatory space. So for the next 30 minutes or so, we're going to really break down the cost to collect, as a two-sided equation and share how organizations can move it faster by pairing safe, maybe even phased automation with proven ways to increase cash collected right now. So you're going to hear Anthony kind of describe, that two-sided equation, so to speak. Now, before we dive into it, I just want to remind everyone that we will have a Q&A at the end. So please drop any questions that you may have in the Q&A section. We'll get to as many of those as we possibly can. And I also like to encourage comments. So if there's any comments that you have, any experience that you have based on our subject of today concerning cost to collect, and feel free to share. I'll be happy to read that to everyone. Um, so with that said, Anthony, you ready to get started?
Yeah, let's do it.
All right, awesome. So the first thing that I want to kind of understand or get to is really to set the foundation. When you say cost to collect is a two-sided equation, what do you most organizations get wrong about how they try to move it, and why does that slow down results?
Yeah. So cost to collect is a relatively simple equation, right? You're talking about the total collection costs divided by the total cash collected, right? So how much did it cost you to get to collect that cash, right? And recently it's become heavily into focus for organizations. It's always been a metric that we've tracked, but it's something that organizations are hyper focused on now. It's come into everyone's crosshairs and really come into focus, largely because of all of the expectations that are being generated around what AI can do and all of the possibilities around there. Um, now, I don't think that it's wrong that organizations have expectations around there. I think what they get wrong, though, is kind of the scale of those expectations or the magnitude of the impact or what you can do with AI today. And it's not their fault, right? I don't expect healthcare providers to be the experts of where AI is and all that. There's a lot of marketing material out there and news about companies laying off tons of employees and replacing them with AI, right? But a lot of this is marketing hype, number one. And a lot of it, the expectations I think people are setting is not necessarily based on where we are today with AI or what we've seen AI already do. The expectations are based on what do we think AI will be able to do in the future. And then I think the expectation is that how do we get there today? But we're not necessarily going to get there overnight, right? We're seeing, don't get me wrong, AI is changing the world. It's transforming the world and it's transforming the healthcare industry as well, literally right now today. But just maybe not as to the scale that people are necessarily expecting. And there's obviously two sides to this. Some people are very realistic about AI and cautious with AI, and then some people are kind of living in 2030 already with their
Right.
expectations for AI.
Absolutely, absolutely. So yeah, and it is something that everyone it has top of mind. I just recorded a segment of our podcast, revenue cycle optimized, about how the expectations are to automate everything. Throw the kitchen sink at it. It just doesn't
Yep.
work that way, as you well articulated, especially cost to collect. It just it's just that's not realistic. It's promising, but it's more of a phased approach. Now, on the numerator side, where do AI and automation most reliably reduce cost today in revenue cycle? And where is the risk highest if teams try to replace human judgment too quickly. I think we may have maybe gave a hint to that answer a little bit.
Yeah. Yeah. So, I mean, AI is obviously impacting the human labor kind of cost, and I think, again, what you hear in the news a lot is about AI replacing humans, but it doesn't actually work that way, right? You think about what humans do in our industry, the processes that they do. Humans do a lot of complex, overarching, long processes for the most part. Very few jobs these days are, my job is I do one task over and over repeatedly, and it's a very simple task. That's not really the way that the human workforce works anymore, right? Um, um, Especially in healthcare. So what AI is doing, and maybe where the kind of expectation mismatch happens, AI isn't really replacing a full human. The way that AI is impacting cost is it's not replacing a whole human process, the entire process that a human does. But it can replace or make humans more efficient with certain tasks. So, like, for example, like data entry. So before, you may need to have one task that a human would do is maybe they receive a fax for an incoming order, right? And that's something that someone has to transcribe into a system, right? But now AI can do that very reliably. In fact, probably more reliably than humans, right? So when you look at how humans do this transcription from scan a document, or an analog document that needs to be converted into a digital system, humans may do that at like a 95% accuracy rate, right? But AI might not also do it perfectly, but AI can probably do it at a 98%, 99% accuracy rate. So this is where AI is actually really impactful, is replacing human tasks, not entire humans. It can't yet replace an entire human. It can, but what it can do is take on tasks that are time consuming for humans, and where it can do it better than a human would otherwise. And what this does is it makes humans more efficient when they're doing their overarching process, and therefore you need less human labor. But you're not really replacing a whole job. You're just eliminating the time consuming kind of tedious tasks that humans do, and making human judgment even more important in this process. Now we're actually using human labor for what we should, for the things that we need to use it for.
Right, exactly. And I like your analogy about the faxes and the coming in, because Infinix has developed an AI agent that actually does that with the dot capture plus. And we found anywhere from 80 to 85% where it actually does not need a human from the time the fax comes in to the time that it goes into EHR or a risk system. Maybe it's an order, maybe it's some other kind of a document, like a legal document. It'll process that. So that's 85% of something that was mundane and someone had to do is now can be focused on maybe a more complex task. Now, 15% of the time, yeah, sure, that's human exceptions arrive, and that's kind of where our approach at Infinix is a tech plus, where it's always going to be, let's put AI where we can put AI to help facilitate, that workforce, but then those exceptions are always going to happen. And that's what we hear staff basically say, thank you. Yes, now I can actually do something meaningful and not something mundane, right? So they get very excited about that. Now, now let's flip to the denominator side. What are the most common places hospitals are leaving, cash on the table right now? And how do they, or how do you basically prioritize which levers to pull first to make a meaningful dent in that cost to collect?
Yeah. So my kind of lens on this, and what happens to me, is I get a lot of organizations, mostly hospitals, that contact me, and they have this high expectation, or they tell me, I've been given the task to reduce my cost to collect by X percentage, and the percentage is extremely high. And yet they're only focused on how they can do that with AI and automation. Again, there's a numerator and a denominator here, right? So if someone gives you this task, and in reality that's not capable, like with the parameters that you were given, or with the parameters that you assumed, it's impossible, right? Like, you can't achieve that level of that level of reduction in your cost to collect with AI alone. And I think this is the big gap that I'm seeing very, very frequently, right? Everyone's like, how do I do this with AI? How do I replace all of my staff with AI? And I have to reel them in a bit and say, well, I can't help you do that. No one can help you yet replace all of your staff with AI.
Right.
The industry's not there. The world's not there yet, right?
Yeah, and
Maybe
RCM
one
is
day.
too complex for it. It's too
Yeah.
complex to do.
And,
Yeah.
and in healthcare, honestly, we're going to be a little bit lagging on purpose. It's a highly regulated industry. There's a lot of risk associated with it. It's I kind of made this point earlier. Like we're going to make decisions based on what we've seen proven to be done already. This is what we have historically done in healthcare. That's what we're going to continue to do. So what I try to redirect toward is like, okay, if this is your goal, if this is what you've been tasked to do, you have a lot of other levers that you can do today. Maybe that vision that you just described to me is somewhere we'll get to in a couple years or in 2030 or whatever. AI is changing very rapidly. It could be sooner. But if you need to get to this year or you need to get to it today, there are a lot of other levers that you can pull on the denominator side. There's a lot of things that you can do to increase your cash. So people come to me with impossible problems. I try to help them solve for their problem in ways kind of outside of what they're thinking about. So, and these are classic things that we find all hospitals have opportunity in. So even if your organization is a top performer, even if you've already done optimization projects in there, one of the top lever that I would always suggest is charge capture optimization. Even top performing organizations, extremely well run organizations, there's always some opportunity in charge capture optimization. And so charge capture optimization would be my number one lever that I'd recommend because you can tend to find literally anywhere from like 2 to 5% increase in net revenue just from doing charge capture alone. It's just extremely impactful and it's going to meaningfully change your cost to collect as well because you're increasing that denominator, which is going to reduce your percentage overall. Number two, I'd probably say strategic pricing. A lot of in my world, the hospital world, this is probably less impactful for like physician offices and things like that. But in the hospital world, strategic pricing can also be extremely impactful. A lot of hospitals may not even increase their prices or not even increase, it's adjust your prices each year. There's a
Right.
lot of dynamics that go into strategic pricing. I don't want you to think that it's just increasing prices by X%. That's what leads to problems, actually. Strategic pricing is doing a market-based approach, pricing things defensively, pricing them appropriately. But this also can lead to, I don't know, anywhere from a 1 to 2% increase as well. After that, and this also depends on the organization. Sometimes your organizations know where they have more problems and more opportunity, but other things are like clinical documentation improvement and coding optimization. These things are complex, and I think people don't necessarily want to focus on them, but there are ways to quickly tackle these things as well. I think people drastically underestimate how impactful, especially in like a hospital organization, optimizing your coding can be. We put a lot of trust into our coders and they drive a lot of our reimbursement. Think about it, a hospital just on inpatient alone being reimbursed on DRG based. If you're not
Mhm.
getting your DRGs captured correctly, it changes your CMI, it changes everything drastically. And some organizations know they have more opportunity there than others, but these are definitely like key levers that you can pull, including like inpatient kind of I call it patient status optimization, looking at the difference between inpatient and observation and getting that right more often than not. That's another big lever. Those would probably be like my top 5 things that I would say organizations can pull today to meet the expectations for that reduction in cost to collect that they tend to ignore because they're too hyper fixated on just what AI can do.
Sure, certainly, certainly. And so, yeah, you mentioned, mid-revenue cycle levers like charge capture optimization, strategic pricing. That's always a big one. I totally agree with that. CDI and then your DRG optimization goes into that coding optimization. So, can you go deeper in one or two examples where you consistently see meaningful lift and then share how leaders should think about sequencing the rest of those? Because it's all about priorities. Where do you start first?
Yeah. I mean, I can start at the top, I guess. So I mentioned charge capture first. I would say in charge capture, just to make it more real or what that means to people, charge capture is largely getting reimbursed for services that you're already doing, right? So this is a form of revenue leakage. Heard that term. We say that a lot in industry,
Mhm.
meaning you're performing these services already, but there's something in your process that's breaking down or something in your technology that can be optimized, that's causing you to not get reimbursed for the services that you're performing and that you rightfully should, right? Hospitals in particular are just extremely complex organizations. Patients go through multiple departments and see multiple providers over multiple dates of service, right? There's a lot of moving parts. There's no one owner over like this patient's care, and everybody has a hand in that. Every different clinician, the way that they capture charges, the way that coding then goes back and codes the account and codes the DRG, all these things, and even beyond just missing charges or something like that, there's methodologies for how you do things, the way that you charge. So, like for example, surprisingly, like some hospitals that we encounter today are still using very outdated methodologies for how they charge for things, and they just never like changed when the industry changed. So, like in surgery, the way that we charge for surgery from a hospital's perspective is not the same as the way that you charge, the way that professional services are billed for surgery, right? On the professional side, we bill for surgery based on the procedure that's performed, right? What surgery did the surgeon perform? There's a CPT code for that, and it's a hard coded charge, you know. But on the hospital side, philosophically, you're not charging for the same thing that the physician is charging for. The physician's already charged for that. On the hospital side, what's the justification for your cost or your charge? It's not what the provider did. They already billed for that. The justification for what you're charging for on the hospital side is the utilization of your hospital, the utilization of your OR, utilization of your nurses, your supplies, your drugs. You're charging for the resources, and
Hmm.
resource is not procedure based. The procedure based doesn't make sense for how hospitals should charge. So modern day, what almost every hospital does now is a time and acuity based methodology. And there's sometimes that organizations just haven't updated their methodologies and haven't kept up with the times. That's just one example. That's just an example that's outside of what I gave. So how you charge for things and what you capturing all the things that you should be charging for. Having someone come in and optimize that for you, utilizing technology as well. So, for example, we offer a charge capture optimization. We have a software that aids us in this. We also bring in teams of consultants that will transform your organization to make sure that you capture all this revenue that you're currently missing. That's extremely impactful.
Yes, it
So,
is.
I kind of talked a little bit about strategic pricing already, but in the sequence, if I had to sequence them, I would give it in the sequence that I laid it out: charge capture, strategic pricing, CDI, coding, patient status. There's other things under this umbrella as well, but these are just kind of my top examples that I tend to reference. Uh,
Hmm.
the point here is you can do an overarching kind of revenue cycle optimization as well, to meaningfully change your cost to collect outside of the AI automation angle. And those are the top five that I would focus on first, but I would focus on everything if that's truly your goal.
Right, right. And to me, it all comes down to processes and procedures, and putting those in step. Like you said, a whole team can come in and show, how that's done, where to get started. A lot of hospital administrators, practice administrators, they don't even know where to get started, So sometimes it's that little nudge and some suggestions and going in the right direction, will get you there. And so I think it's
Yeah.
also a matter of orchestration. Everything you described, every one of them can be impactful, but imagine as they're all impactful coming together, they get almost like singing, a song together, so to speak, in a chorus where it just all kind of hums and sounds very harmonious, right? So, but it may take a little while to get there for that.
And think about like how impactful it is to bring in a third party. And I'll explain this a little bit too. One, your folks internally already have full-time jobs. They're already busy, right? So you need some additional resources ideally if you want to do this quickly and find this value quickly. There's also the whole just human psychological side. So when I talked about charge capture, and again, that being the most impactful, one of the things that is incredible about human beings and just human nature is we're really really good at rationalizing what we already do, right?
Right.
So the reason to bring in a third party, and this is not just technology alone, we have technology, and what we've seen with this is you can feed people all these opportunities. You're literally handing them golden nuggets, right? But people
Hmm.
are extremely good at rationalizing what they already do. So you tell them you need to update your surgery methodology, like I just described in this example. And they'll say, oh no, this isn't a problem. We know that this is what we do. And so like you know what I mean? Like humans are just very good at rationalizing what they already do. And you need a third party to come in and challenge you sometimes and kind of shake you out of your bad habits and say, no, you're behind the rest of the industry. Here's a better
Absolutely.
methodology. Here's the proof. And, just challenge you to, push yourself out of your comfort zone a little bit to really move forward because humans are exceptional at justifying what we already do.
Right. Exactly. Exactly. And that's amazing. So, and which kind of leads to the next questions is a lot of leaders want to know, what is real versus hype? So what does a credible timeline look like for safe, and we want to say automation? We've already kind of talked about that, but in a regulated revenue cycle management environment, and what operational readiness steps have to happen before AI can even scale?
Yeah. So one, I mean, definitely there's a lot of hype on AI. Not that AI isn't transformative and impactful. It is, as we described in tasks. So I think everybody's looking for this value as soon as possible, right? And a lot of what I measure our success on is how fast can we get to that value. And of course, not to neglect this, I know we're talking about this, but of course, AI and automation and technology is something you can do very quickly. Now, in limited ways, right? So, as I described earlier, you can replace humans with mundane tasks that are as simple as data entry almost right out of the gate because it doesn't require any special training for AI models or anything like that, right? These are tasks that AI models already know how to do. They've already been trained to do.
Mhm.
There's immediate value in that, of course. So if you're looking at the timeline and how to accelerate things, yes, there are technology things, but as you think about the timeline for just the automation side alone, it's going to take time to get to the rest of it if you want to do it safely, right? So, for example, coding, like people are so focused on autonomous coding and things like that.
Mhm.
Again, autonomous coding is going to be used in where you start in your organization is you're going to start small. You're going to start on simple visit coding, things like that. Maybe some simple exams, radiology, stuff like that. And then your technology partner gets more ingrained with your organization, then you can scale up more. And as you learn more about the organization, as you get more familiar with their record systems, how physicians document, it's not all the same. Not every physician documents the same, right? So like
Right.
you need to do this in kind of pragmatic, safe ways as you build up, just even on the AI side. But as you're doing all that, that's going to take you realistically a couple of years to really optimize what you can do. And AI is going to keep changing. There's going to be more automations. That's just like an ever evolving kind of path. But there is a ramp up period, and even when organizations advertise they have capabilities to do certain things, know that it's not something that you just come in, flip a switch, turn it on, and everything's standardized across the industry. So therefore, it's a flip the switch type of thing. It's not. I mean, most things need to be scaled up and implemented in a smart kind of safe way, right?
Sure, sure, absolutely.
So that can take years. And
Mhm.
what you can do on these other side, all these other levers that we're talking about on the denominator side, you can actually implement those things incredibly fast as well. So probably before you can achieve all of your AI goals, you can implement all of the other things that I talked about.
Awesome, awesome. So, and speaking of timelines, if a CFO asks you for a 90-day plan to improve the cost to collect with measurable ROI, there's that word ROI. It's not really a word; it's an acronym. But what what would the balance roadmap look like, and what metrics would you use to prove progress in both cost reduction and cash improvement?
Yeah, so interestingly, technology actually plays a role in both sides of this, right? So as I said, I mean, I would immediately hit your simple tasks with tools that you can replace, with the simple tasks you can replace with AI tools and automation, right? Those things that we know we can do. 90 days is short. But on the other side of these things that I was talking about that we can do in less than a year, um, the way to do them faster is also utilizing technology. So like charge capture, for example, our charge capture solution is also very technology based. We can review 100% of your claims going back a year, We can go back further, but it usually doesn't make sense to go back any further than a year because the data is stale beyond that point. We can pinpoint and aggregate all of the opportunities that you had over the past year for things that were missed or could be done better. We can do that almost in overnight with our technology, right? And then there's the implementation phase. So then you'd be focused on that 90-day implementation phase. Now, if you really want to have an impact in 90 days, the organization is going to have to make this a priority because the technology goes so far. The technology pinpoints our opportunities, but if you want to take advantage of those opportunities in a very short, like 90-day timeline, for example, you're going to have to implement extremely quickly, which means it's not impossible to do. It just means that you have to get all of your organizational department leaders prepared for this and say, this is the direction we're going. We have to make these changes by X dates to see the results. And so the way that we measure these things, so for example, on like charge capture is you can literally measure on all of so let's say surgery visit, keeping with the example because I gave it, right? Immediately, if we change that surgery methodology and build that into our system, most systems drop charges automatically now based on time and acuity, EHRs. And we can help configure that. Of course, we're a technology company, we know how to do that as well.
Right.
We also do the EHR implementations and conversions. So we can help load that, get that loaded in for you. You can see that impact immediately. As soon as you go live, test it, go live with it, you'll start seeing the impact of that and seeing the impact in claims. And the way that we measure this, though, is based on actual validated payments, changes in payments. So we baseline so using the surgery example, we baseline what you used to get on your surgeries. So if you kept your old methodology on the surgeries that you've done since we went live, so let's say we went live with this in 60 days. By that 90-day mark, we'd have 30 days to look back and say, here's the last month. If you would have kept your old methodology, procedure-based methodology, this is what you would have achieved in net revenue. We can predict that perfectly because we know exactly how you used to get reimbursed or how you get reimbursed and how you would have charged for those. Versus, here's what you're doing now, and here's what the reimbursement is, and here's the delta. Very concrete net revenue difference in 30 days.
Awesome. Awesome. Well, that's all the questions I have, Anthony. I'm going to kind of go to the audience questions and see if there are any. Really, as we go through these, if you want to drop a few, we do have just a few minutes left, and I do have two questions here, and I'm just going to read the first one. And it looks like, we've already kind of answered the first part of this question, but not so much the second part. So I'm just going to read the whole question for context. So, what metrics should leaders track to prove the denominator strategy is working? And I think that's the part we've already answered, right? So then,
Yeah.
how do you separate true cash lift from timing shifts, one-time cleanups, or payer mix changes? I think it's looking for those. You're going to have a huge dump of cash come in, right? And then how do you normalize that? I guess that's the point of the question, if I get it right.
Yeah, I think I understand this question. I think that oftentimes when you're talking about different initiatives that may be impactful or have an ROI, right, it can be hard to kind of wrap your mind around, well, did this, so going back to the surgery example, just to keep us consistent, how did this, how come, how do I know that we just don't have a more favorable, not that that ever happens right now, a more favorable payer mix, for example, but
All
how
right.
do we know this isn't based on payer mix or based on volume? And so it is important, right? Like I do think that oftentimes when you'll work with certain vendors, for example, they're going to try to sell you on some high level math of like, last month your surgery department revenue was this, and this month your surgery department revenue is this. That's far too high level. I mean, there are so many variables that could be changing that. That could be literally volume alone. I mean,
Right.
volume's easy to sort out, right? But like it could have been a payer mix. In payer mix, this doesn't mean a grand payer mix thing. Sometimes when you look at a smaller surgery department, if they only do a handful of cases anyway, literally in that 1 month that you're measuring, yes, they could have had a bigger payer mix change. But where you really need to focus here and make sure that someone's not trying to hoodwink or pull the wool over your eyes,
Right.
or not that they're trying to do that they're just oversimplifying. That's the risk, right? So kind of what I described earlier with how you would do that methodology to methodology comparison, it's 100% concrete. It's claim to claim. It's this claim would have been this. And so it's based on the actual claims that transpired, not the past. So the past mix might have been different. So the whole baseline of past, those are different cases. What I'm talking about measuring is actual same to same. Same claim. On this claim, you now got reimbursed $1,500, whereas before this exact claim, before, if you would have charged the way that you used to charge, it would have been 1,000. That
Hmm.
there's no other variables driving that. So
Right.
this is what we do when we show value to clients. So there's no question.
Awesome. Awesome. And then here's the other question. Again, it looks like you may have answered this partly, but I'll read the whole thing. If we have limited resources, which function should we tackle first, which I think you've already kind of gone into, to increase cash collected quickly, and how do we avoid creating downstream compliance risk while moving fast?
Yeah, there's a couple questions in there.
Yeah, it is.
So I definitely think limited resources is kind of the norm. I see why they ask, because everybody has limit. This is the biggest thing that we hear about. So now I'm going to address this in a slightly different way too, because regarding the resources thing, we encounter this a lot, right? So for example, especially in like nowadays we talk about processes and improving processes, right? But processes are also supported by technology almost across the board in a hospital. Everything is run, every process we do is in some way supported by technology. And one of the biggest kind of challenges that we see is like IT bandwidth, right? Like we know we can type these things up, we have all these other things going on, and we just don't have the bandwidth to do this. And so sometimes this happens to us when we're there trying to help an organization improve a process, right? Now I think one of the key ways to do this is using third parties, like I said, bring in additional resources who can support you. So in our case, for example, we bring in the additional IT resources that can do the implementation for the organization. We handle that part because of this specifically. So I think it's important to choose your third party support. There's a lot of people who are going to put all the onus back on you to self implement. Whereas like Infinix, for example, we will do the implementation for you in almost every case. So we do alleviate a lot of those limited resource issues. So I think firstly, be cautious on like knowing what's going to be asked of you when you're working with a third party. Um, and then secondly, yeah, so once you overcome like especially the IT hurdle, then it's just about prioritizing, right? So it's all those things that we talked about. So yes, there's things you can do with technology that you can implement quickly. But of course, I would still hit charge capture number one, just because it can be done so quick with the technology we have, right? I need to clarify that. If you don't have a technology solution like ours to do charge capture, it's not quick. We can do it like overnight. We can identify your opportunities very, very quickly and aggregate them up and determine exactly what to pinpoint and work on the implementation with. If you don't have a technology, you can't actually do that. You can spend years auditing claims, throwing tons and tons of human resources at it, and never find your big opportunities
Mhm.
because maybe they
Mhm.
may be 2% of your things, but those 2% of things could be extremely impactful. And in fact, most charge capture opportunities are like 2%. They're marginal improvements, but they're impactful marginal improvements, and they're hard to find without a technology. So finding probably finding a technology partner who can do these things in accelerated ways, who can support you given your limited resources, is really truly the fastest way. Um, and then avoiding downstream compliance risk. This is just not being, don't, we would never do this, but and I don't know who would do this, but obviously, I think I think hospitals could push technology vendors to try to do something too fast, and you should be
Right.
cautious of that, right? You should want to see the proof. Show me how this is done. Show me how this is working. Show me that it's accurate, and not just be recklessly, plowing ahead. Because
Mhm.
I don't think there's many companies out there that would, risk their own reputation just
Right.
because the client pushed them. But given what I said with the expectations that are being brought to us, I could see it happening. So just proceed cautiously with AI. AI is it seems really powerful, but it's probably not as powerful as most people think. It has so many more limitations just with what it can do with its context windows and There's only so much that it can handle, hence why it can only do tasks and not big processes. And
Right.
once you give it too much context, even in the example of like medical records, I talked about autonomous coding. So AI is really good at reading text. It can consume vast amounts of text and hold that in its long context. But when it has to also include other different types of media, images and videos, it blows up the context window, and then the quality degrades. It can degrade to near zero. So
Right.
I think people don't necessarily realize its limitations, and just be cautious of those limitations, and limiting your automations and kind of AI interactions to much more narrower tasks, and you'll be much safer, because like AI hallucinates. If you overload its context, it will hallucinate, and it can't find the context that it's looking for, and it will make stuff up. It
Yes,
will.
it will.
So if you've used AI a lot, and if you're not, just go chat with it for a long conversation, and ask it to recall stuff from the beginning of the conversation. You will notice that it forgets. And this is real. This is a real limitation. So
Mhm.
keep those limitations in mind. There's a lot of people, smarter people than me, that are working on this stuff at Infinix and across the world to make AI better. But until we get there, realize that its limitations should be more focused on narrow tasks.
Nice, nice. Well, I don't see any other questions, and that's all the questions I have. Anthony, really appreciate you joining us today. It's a lot of great insights. There's a lot of stuff impactful and packed in everything that you said for sure. So really appreciate you coming on today.
Yeah, thanks for having me. Thanks, Stuart.
Yeah, absolutely. And I want to thank everyone else for joining us as well for this episode of Office Hours. Be sure to check out our podcast, Revenue Cycle Optimized. Wherever you subscribe for podcasts, you can find it there. And also be sure to go to Infinix.com for more case studies, articles, as well as solution insights for all things RCM. So till then, we'll see you next time.